Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome back to another episode in the series of breast cancer surveillance, new approaches. In the previous two episodes, I've spent plenty of time discussing surveillance regarding breast health in general. I want to dedicate a few minutes discussing breast health and breast cancer screening when a woman is using hormone therapy, because this is one of the main concerns women have as far as hormone therapy risk, especially breast cancer risk. Because even if it's not true that hormones will give you breast cancer, women have been told for 20 years now, more than 20 years, since 2002, that breast cancer risk is higher for women that use hormone therapy for menopause. Now, all women would like to know what they can do to minimize their breast cancer risk while they use hormone replacement therapy or hormone therapy for menopause, because there is indeed an association between hormone therapy and breast cancer, even if hormone therapy does not necessarily increase your risk of breast cancer. Let me make it clear from the beginning that even though the media and others, but specifically the media, made such a big hullabaloo about being on hormone therapy and how it greatly increases your breast cancer risk, guess what? No one out there is recommending increased surveillance for women who are on hormone therapy for menopause. I wonder why. If we accept that there is such an increased risk with hormone therapy, and if hormone therapy is absolutely necessary for some women because they can't sleep, their hot flashes are terrible, they stop having sex, their hot flashes are causing high blood pressure, and they have all these terrible consequences, so there is an actual medical need to use hormones, why is there no recommendation for increased surveillance if there's such a fear? Well, there are no special guidelines outside of the routine screening guidelines, which require women who use hormone therapy for menopause to screen more frequently or to use a more targeted imaging technique like an MRI or a 4D ultrasound or a thermography, like other things on top of a mammogram. So a lot of women worry a lot when they start estrogen therapy because they've heard, and even if they don't necessarily believe it deep down and they know that there's some misinformation there, and they know that estrogen was important because they had it for 4 decades and now they lost it, they feel terrible. So they're willing to start estrogen therapy, but they still wonder, is this going to increase my risk? Is this going to give me breast cancer? And I'd like to answer that question by reminding you about one of my favorite, very simple analogies, which is the dying flower in a beautiful pot analogy. So when a woman asks whether or not hormone therapy is going to increase their risk of breast cancer, I use this analogy. So I'm going to use it again today, and I'm going to remind you because this highlights the special relationship that exists between estrogen and breast cancer. Again, this analogy, or let's call it a metaphor, came to me one day as I was walking my dog. I was looking at the plants on the side of the road. I believe it was a beautiful, beautiful spring day. And I was dictating notes from my podcast and into my iPhone. And I believe it is very easy to grasp and understand how hormone therapy will impact your chance of breast cancer or the breast cancer risk. So imagine you have a beautiful flower pot. There's a beautiful flower that's not doing very well. It's actually withering away. Right next to the flower, there might be a small little weed that you're barely noticing, but you don't really worry about the weed so much because you're just worried that the plant's going to die. Matter of fact, the weed could be so small and you're so focused on the dying plant, you're not even seeing the weed at all. So obviously the dying plant would be the body who is going through a severe estrogen deficiency and who's feeling terrible and is not feeling good. And the weed would be an existent, small, slow progressing breast cancer. There also might be a germ for the weed that hasn't got a hold or germinated in the soil, but is there yet. But the conditions are favorable for the weed to grow, even though there's just a few seeds. You can't even see them. So you start watering the plant daily and apply Miracle-Gro regularly to try to save the plant, to bring the plant back to life and to have a beautiful plant in a beautiful flower pot. Obviously, with the Miracle-Gro and the daily watering, the plant is coming back to life. It's looking beautiful again. So what do you think will happen to the barely noticeable weed or to the seeds of the weed that were already in the soil? Or what do you think will happen with the conditions that were auspicious for the weed development once they started receiving daily water and Miracle-Gro regularly? Well, the watering of the Miracle-Gro will also nourish the development of not just the beautiful plant, but also the weed, who is now becoming apparent and will need to be pulled, dug out, have some weed killer, whatever you decide is appropriate. Obviously, the beautiful plant is your body and the weed is a possible pre-existing breast cancer that you're not even aware of, or maybe a breast pre-cancer tissue change, which you already have at the time you start estrogen due to a metabolical inflammatory disruption, or you've already been exposed to hormone disruptors, a condition you probably had for years, but you have been totally and completely unaware of. And the truth is, no one tells women that breast cancer is very slow growing in the great majority of cases. So yes, it will be many years before a breast cancer will become apparent. So the newly started patch, the compounded cream, or the pellet therapy for the past 1 to 2 or 3 years did not cause it. It just acted like the catalyst, just like in the weed and plant story with the Miracle-Gro in the water. The hormone therapy will act like a catalyst. It will probably speed up the already developing breast cancer. So there is a complex relationship between breast cancer and hormones. That is, if you have a breast cancer estrogen receptor sensitive into your breast already at the time of initiating hormone therapy, the hormone therapy will not help. It doesn't mean that your cancer will progress faster. It will likely become more apparent. It will probably be grown a little bit quicker than its normal speed. As like I said, most breast cancers are slow progressing, but it's not the recent hormone therapy that caused it. Consider that there might have been 10 to 20 years of previous exposure to chemicals, radiofrequency, toxins, and hormonal imbalance. Many things that are known to cause and related to the actual causality of breast cancer. Once you start hormone therapy for menopause, your body will feel better. Hot flashes will disappear, your sleep will improve, your mood and energy will be uplifted, your entire body will be rejuvenated with the hormone therapy, so to speak. Now imagine that same process of rejuvenation is applied to the small, maybe slowly developing precancerous or very early cancer cells in the breast. Imagine what this type of rejuvenation will mean for these areas. Just like the weed in the metaphorical analogy I used earlier, you will now become aware of this situation, that there's something happening with your breast, either because while on hormone replacement therapy, every doctor is a little bit more careful and they do follow the mandated surveillance screening guidelines, which means you are going to detect it early, or because it became palpable and you, the patient, feel it, and now treatment is required. Once we get to that point, you will likely be told to stop the hormone therapy as it could promote the growth and development of the cancer. And that's probably very correct if it's an estrogen receptor positive cancer. it's unknown what estrogen impact has on non-estrogen receptor positive cancers. You stop the hormone therapy, most of your menopause symptoms can return. You are now subject to radiation, to chemo, to surgery of various combinations of these. You're advised to use cancer hormone therapy, drugs that block all hormone actions from causing further cancer development or recurrence, all in the name of achieving a cure. And here's the thing. Because we're talking about breast cancer surveillance, I wanted to do this little bit of a detour and talk about breast cancer because not one person on the woman's cancer treatment journey will be or is, in case you are already a breast cancer survivor, not one medical trained person, be they a doctor, a nurse, or a counselor, none of them will be focused on why this cancer happened to start with. Unfortunately, that is not your oncologist's job. Their job and their ultimate goal would be only how to destroy and eliminate the current cancer, how to get you to the point where you are cancer-free. So the diagnosis of breast cancer and the cancer in general, but specifically breast cancer, sends many women down the path of self-discovery because ultimately it is you, the woman at risk or the woman in the thick of it all, so to say, who is the solely responsible person to find out what were the triggers and contributors of this cancer. What are the factors and the circumstances which are probably still happening in your life that have led to this cancer that, if not addressed, will likely cause a recurrence. It will be your job to understand what needs to be eliminated. It will be your job to understand what needs to be changed, what needs to be detoxified and how. And it will be your job to learn how your diet needs to change. You're going to be in charge of managing your own stress, dealing with the possibly toxic people in your life, as well as analyzing and optimizing your sleep pattern, just to mention a few of the things you will be in charge of. You're going to be in charge of all these complicated processes, which is what is really going to protect you from your cancer never coming back once your oncologist manages to have you cured and in complete remission. So after this little tiny detour, I would like to continue today's episode by strongly advising all women to rely on themselves to lower their risk of breast cancer, not just on the annual mammogram. As a recap, I made the point in the previous 2 episodes that breast cancer screening does not detect early changes in the breast tissue that are precancerous or changes that would increase your risk of cancer. Breast cancer screening using imaging techniques like mammography will unfortunately only detect breast cancer once it's already developed, but we're hoping it will be in an early stage, a curable stage, giving you a 90 to 95% survival rate. There are many women who eat poorly, exercise very little, have a poor sleep pattern, have a lot of stress, have a lot of hormonal imbalance, and do not pay attention to their toxic exposure and believe that if they religiously do a mammogram once a year, that's protection. You are not protected by doing a mammogram. Paying attention to how your hormone balance feels in your body is probably one of the most important breast cancer reduction factors you can control. As a woman who has had hormones for so long, 4 decades by now, once you enter menopause, because remember, 90% of all cancers are 50 and beyond. As a woman, you will feel if something is off hormonally. All you really have to do is partner with a physician who understands your concern, listens to your symptoms, and charts them in detail, who is willing to order hormonal testing, whether it's blood hormone levels or urine hormone metabolites or both, and formulate the plan that would best suit you in your specific situation and ensure that hormonal imbalance is not going to contribute to your increased risk. There's unfortunately not much most women can do regarding controlling their environment for radio frequency exposure, for example. There's Wi-Fi's everywhere, cell towers everywhere. There's also not much we can do, even though we try our best, to avoid exposure to endocrine disruptors Unfortunately, those are ubiquitous nowadays. But controlling our hormonal environment is something any woman can do. Again, with the help of a skilled and trained physician or another type of medical provider that's similarly trained, skilled, and experienced. Many women are really worried about menopause hormone therapy increasing their risk of breast cancer. But once at menopause or in the postmenopausal years, many women fail to realize is that decisions they have made regarding their birth control method, for example, 20 or 30 years ago could have increased the risk of breast cancer for later in life. I made this point in another episode earlier. I will revisit it here. For example, if a woman uses birth control pills for 20 to 25 years, maybe even 30 years, she will have significantly increased her risk of breast cancer due to her choice of birth control method. Google it if you do not believe me, but a woman who uses birth control pills for 20 years, her risk of breast cancer will increase by 20 to 30%. Guess what? That is exactly what was the reported increase of breast cancer risk with Primpro in the WHI study reported in 2002. That's the study that scared all women off hormone replacement therapy and scared all doctors from prescribing hormone therapy. There was a 26% increased risk. As it turns out, that was a relative risk. The absolute risk went from 0.13% to 0.138%. Something ridiculous. But guess what? There is no major statement coming from ACOG, the American College of OBGYN, or other medical organizations asking women to stop all birth control pill prescriptions because this risk for breast cancer. So why scare all women off of HRT? Well, this is food for thought, but I'm going to continue talking about my topic here. I'm going to take the case of a woman who is starting hormone therapy at menopause in her late 40s, maybe early 50s. Shortly after, she's going to find out, hopefully none of our clients, this is a hypothetical patient, right? None of you listeners should be in this situation. So this woman will find out shortly after starting hormone therapy, maybe a few years into it, that she has breast cancer. And at that point, all the doctors involved, including the woman, will be immediately and absolutely sure that she got the breast cancer because she used hormone therapy. Now, here's the thing. No one, and that's absolutely amazing, no one asks, all right, how many years did you use a birth control pill? We should. We definitely should. And if someone tries to tell you that, hey, you got cancer from these 3 years of patches you've used, you should say, no, I used my birth control pill for 20 years. It's probably due to that, or it could be due to the both. This question about your previous history of exposure to estrogen receptor disruptors, which is what the birth control pill is, needs to be asked because it matters. Doctors and women alike need to stop blaming hormone therapy for menopause, which, by the way, saves lives. And we need to start looking into what type of exposure young women have during their early lives, what lifestyle they lead, and how much and how severe their hormone disrupt exposure is throughout their life, increasing their risk of breast cancer later in life. So continuing along the lines of what I promised I was going to do at the beginning of the episode, talk about breast cancer surveillance while on hormone therapy, I want to talk a little bit about the correlation between dosing and length of therapy for hormone therapy after menopause, whether or not this will increase a woman's risk for breast cancer. Are you on a lower dose? Is it safer? Is a higher dose going to give you more cancer? Is it going to give you cancer faster? 2 years on hormones versus 10 years on hormones? What's better? Should you stop hormones after 5 years to lower your risk? We don't really have an answer to any of these questions. But I would like to say here that many women ask, give me the lowest dose of hormone therapy, please, that is not going to increase my risk of breast cancer. And I do want to reiterate here for your information that we do not know what that dose is. And that dose, the lowest dose that would not increase your risk of cancer, is going to be very different from person to person. It depends on your burden of exposure, your ability to detoxify your hormones. It depends on what you've been exposed to in the past, your sleep pattern, your liver function, your digestive function. It depends on so many things. I have made the point in the past that the lower the dose and the least exposure to estrogen after menopause a woman gets, the more available her remaining estrogen receptors will be to engage with crappy stuff, with hormone disruptors, which are abundant in any woman's environment, no matter how hard we all try to control it, and no matter how clean we eat and live our lives. On the other side, think about this. The higher the dose, the more likely that the body will be able to grow a pre-existing cancer faster and make it more apparent. That is true. Also, the longer a woman is using hormone therapy, the higher the risk for breast cancer as she advances decades away from menopause, not necessarily because she's on therapy for hormones, but because she is moving further and further away from menopause, which is how the breast cancer risk tracks. The older a woman gets, the higher her risk of cancer, independent of using or not using hormones. Now, as it turns out, there is a very important protective effect of estrogen, which more and more people, scientists, doctors, and researchers are talking about. Hello, is this true? Is this possible that estrogen actually protects women from breast cancer? Yes, there's new research and is most likely going to show that women who use hormone replacement therapy have a lower risk of breast cancer. Now, we don't know that this is for sure. We need more studies to show if that's true. What we know is that for the past 20 years, women were told to stay away from hormones. So any study at this point involving women who have been postmenopausal in the past 20 years is obviously going to be skewed by the fact that these poor women were told that estrogen is going to increase their risk of breast cancer, so they didn't use estrogen. So I wouldn't include them in any comparison studies other than just go forward. Let's see. If women now decide to use hormone therapy versus they don't, what is that going to show? We do have safer therapies now compared to what we had back in the 80s and 90s when the WHI study was used. So when you decide to use hormone therapy or not, you need to keep in mind the fact that the whole idea of using hormone therapy is to have it optimized for your body. I did talk about this not too long ago about hormone optimization, because you and your doctor need to properly address your concerns and improve your overall health and wellness, because the risk of breast cancer related to hormone therapy has been proven to be minimal, just as minimal as the risk of using a birth control pill for long term, probably even less than using a birth control pill. So the idea is not to worry too much about hormone therapy. Worry if it's too low for you or if it's too high for you. You should worry that it's not optimized properly. You should worry that it's not balanced well. For those women who agonize over, should I start, should I not start hormone therapy, I always recommend start with the lowest dose and do that for a while, making sure you have relief of your symptoms. More importantly, making sure you do not have side effects or some kind of clear indication that there is an imbalance in your hormones. And as you either experience improvement or wish to continue hormone therapy, or if you have no improvement, but you still wish to continue increasing the dose of estrogen or testosterone or progesterone or a various combination of these three hormones, please keep in mind that using a form of hormone therapy that is not optimized and not ideal for alleviating your symptoms is not going to serve you in the way that you believe it should or that in the way that it could. And that is because not addressing the symptoms, all the symptoms and concerns, which are disturbing your health and your immune system by disturbing your mood, your energy, your sleep, which impacts all your other hormones, your cortisol, your insulin, your thyroid. By not addressing the estrogen and testosterone hormone deficiency properly in the long run, and by not balancing it properly with progesterone, this will probably be one of the main contributors to increasing your risk of cancer. All hormones have to be balanced and optimized in order to protect you, the patient, and in order to not increase your breast cancer risk. I would like to end this episode by pointing out a very, very important truth. And I kind of left it for the end. And I guess I could talk more about this in the future, but here it is. Estrogen and testosterone are opposing hormones with opposite effects on the breast. Many hormone therapy regimens prescribed for women in menopause and after menopause usually only include some estrogen and the usual mandatorily required progesterone, completely ignoring testosterone deficiency. A woman's body has testosterone and has had testosterone for decades for many reasons. One of these many reasons is the fact that testosterone has a very valuable opposing influence on the breast tissue. Please remember, estrogen grows the glandular tissue of the breast, while testosterone has an anti-proliferative and atrophying, shrinking effect on a woman's breast tissue, which means it has the same effect on a slow-growing breast cancer. It means that therapeutic testosterone is associated with protective anti-estrogenic effects in breast tissue, possibly reducing breast cancer risk. So do not forget about testosterone. I spoke about hormone balance earlier, and unfortunately, many women are only prescribed estrogen and progesterone with no testosterone therapy. If you are one of these women, please look further into testosterone therapy because estrogen is your yin hormone, whereas testosterone is your yang hormone. And everything in nature has to be balanced. And the main opposing hormone to the proliferative action of estrogen on the breast tissue is not progesterone, is actually testosterone. I will end this episode here, and I have a very quick, short announcement to make. As of May 1st, I am launching my Substack platform, and I would love to have you there. I will speak more on such topics as these. I will offer monthly webinars, and I will be recording very special brief episodes loaded with useful information about hormone therapy for menopause, longevity, peptide therapy, how to use peptides for weight loss without being hooked on them forever, and more. So please look me up on Substack. I'll give you the handle pretty soon. Keep following me, and I will talk to you next week and end with a bow, part 4 to the breast cancer surveillance and how to decrease our breast cancer risk. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas. So please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.